Hello, and welcome to another episode of Successful Health Habits. As obesity rates continue to rise, weight loss has become a top priority for many individuals. While diet and exercise remain the most effective methods for achieving sustainable weight loss, FDA-approved weight loss pills have become increasingly popular in recent years. In this video, we will explore some of the most popular FDA-approved weight loss pills that actually work, including their pros, cons, and general warnings about being careful. The number one weight loss pill we will discuss is Ozempic. Ozempic, an injectable drug for weekly use manufactured by Novo Nordisk, contains semaglutide as its active ingredient. While initially approved for type 2 diabetes treatment, Ozempic is sometimes used off-label for weight loss. In comparison to other drugs containing semaglutide and approved by the FDA specifically for weight loss, Ozempic has a lower amount of semaglutide. The pros of Ozempic. Clinical studies have shown that Ozempic can lead to significant weight loss in people with type 2 diabetes who are overweight or obese. Ozempic works by mimicking a hormone that regulates appetite and blood sugar levels, which may result in decreased hunger and cravings. As an injectable medication, Ozempic may be more convenient and consistent in its delivery than oral weight loss medications that may be affected by digestive issues or variability in absorption. The cons of Ozempic. Like any medication, Ozempic may cause side effects, including nausea, vomiting, and diarrhea, which may negatively impact quality of life or adherence to treatment. Ozempic may interact with other medications, so it is important to discuss its use with a healthcare provider before starting treatment. The number 2 weight loss pill we will discuss is Orlistat, Xenical. Orlistat, commonly known by the brand name Xenical, is an FDA-approved prescription medication that works by blocking the absorption of fat in the body. This medication is intended for individuals with a body mass index (BMI) of 30 or higher, or those with a BMI of 27 or higher who have other health conditions such as diabetes or high blood pressure. The pros of Orlistat. It can help with weight loss when combined with a healthy diet and exercise. It is FDA approved for long-term use. It can improve cholesterol levels. The cons of Orlistat. It can cause gastrointestinal side effects such as diarrhea, gas, and bloating. It may decrease the absorption of fat-soluble vitamins, so a multivitamin supplement may be necessary. It should not be taken with a high-fat meal, as it can increase the risk of side effects. Where to buy? Orlistat is available by prescription from your healthcare provider. The third pill on our list today is Phentermine, Adipex-P. Phentermine, also known by the brand name Adipex-P, is an FDA-approved prescription medication that works by suppressing appetite. This medication is intended for short-term use, a few weeks, in individuals with a BMI of 30 or higher, or those with a BMI of 27 or higher who have other health conditions such as diabetes or high blood pressure. The pros of Phentermine. It can help with weight loss when combined with a healthy diet and exercise. FDA approved for short-term use. It can improve blood sugar control in individuals with diabetes. The cons of Phentermine. It can cause side effects such as dry mouth, insomnia, and increased heart rate. It may be habit-forming and should not be used long-term. Should not be taken with other medications that affect serotonin levels, as it can increase the risk of a rare but serious lung disorder called pulmonary hypertension. Where to buy Phentermine is available by prescription from your healthcare provider. The fourth pill we will discuss is Liraglutide, Saxenda. Liraglutide, commonly known by the brand name Saxenda, is an FDA-approved prescription medication that works by mimicking the effects of a hormone called glucagon-like peptide 1, GLP-1. This medication is intended for individuals with a BMI of 30 or higher, or those with a BMI of 27 or higher who have other health conditions such as diabetes or high blood pressure. The pros. Liraglutide. It can help with weight loss when combined with a healthy diet and exercise. It is FDA approved for long-term use. It can improve blood sugar control in individuals with diabetes. It may also reduce the risk of cardiovascular events in individuals with heart disease. The cons of Liraglutide. It can cause side effects such as nausea, diarrhea, and constipation. It may increase the risk of pancreatitis, a rare but serious inflammation of the pancreas. It should not be taken with other medications that affect GLP-1 levels, as it can increase the risk of thyroid tumors. Where to buy? Saxenda is available by prescription from your healthcare provider. The last pill we will discuss is Contrave. Contrave is an FDA-approved prescription medication that combines two drugs, bupropion and naltrexone, to help with weight loss. Bupropion is an antidepressant that can also suppress appetite, while naltrexone is a medication used to treat alcohol and opioid dependence that can also help reduce food cravings. The pros of Contrave. It can help with weight loss when combined with a healthy diet and exercise. It is FDA approved for long-term use. It may also improve blood pressure and cholesterol levels. The cons of Contrave. Can cause side effects such as nausea, constipation, and headache. May increase the risk of suicidal thoughts and behavior in individuals with a history of depression or other mental health conditions. Should not be taken with other medications that affect serotonin levels, as it can increase the risk of serotonin syndrome. Where to buy? Contrave is available by prescription from your healthcare provider. Before we close this episode, here is a general warnings. While these FDA-approved weight loss pills can be effective for some individuals, it is important to approach them with caution. It is essential to remember that they are not a magic solution for weight loss and should be used in combination with a healthy diet and exercise. It is also important to note that these medications may not be suitable for everyone, and a healthcare provider should be consulted before starting any weight loss program. Additionally, these medications can cause side effects, and it is important to be aware of them and report any concerning symptoms to a healthcare provider. It is also essential to follow the dosing instructions carefully and not to exceed the recommended dosage. In conclusion, FDA-approved weight loss pills can be a helpful tool in achieving weight loss goals when used in combination with a healthy diet and exercise. However, they should be approached with caution and only used under the guidance of a healthcare provider. As with any medication, it is essential to be aware of the potential side effects and to report any concerning symptoms to a healthcare provider. That's it for today's episode of Successful Health Habits. Remember, here at Successful Health Habits, we are not just making videos, we are changing lives together and giving people the tools to live well, physically, mentally, and financially. Please subscribe and share with a friend or coworker. Thank you for watching.